All right, well, good afternoon and good morning once again. Thank you all so much for taking some time out of your day today to join us. My name is Lauren Rabinowitz, and I am moderating today's session with my co-host, Kate Wasserman. We are here with the TA Network and so excited to be hosting our June session of our Early Childhood Learning Community. We have a slightly shorter time allotted today than we do normally, so I'm just going to very quickly be handing the presentation over to our wonderful panel. But just before I do that, if we could advance the slide, Laura. I believe Laura is the one who is advancing the slides. Thank you so much. Just want to note that this webinar is being hosted by the National TA Network for Children's Behavioral Health through the University of Maryland, and all the presentation, all the views and comments that you hear today are those of the presenters and not representative of SAMHSA or the Department of Health and Human Services. And we can go to the next slide. Okay, and right before I hand it over, I do also want to make sure that everyone is aware of the webinar platform features. We do have our chat box, so if you have any questions, comments, thoughts for our panelists, please feel free to use that chat box. We will stop if need be, and we also will be holding some time at the end for questions, so please feel free to communicate with us that way. If you're having any issues with the technology, you can also use that chat feature, and we will give you our best attempt to help get you connected. So once again, thank you so much to everyone, and I'm going to hand things over to Kavita right now. Thank you.
Hi, good morning, good afternoon to everyone. Thank you again for joining us. My name is Kavita Bernstein, and I'm the program manager for Children's Health here in Arizona at an agency called First Things First. We are the state agency for early childhood health and development in Arizona, and I'm very honored to be joining you all for this webinar. Peggy, do you want to introduce yourself next?
Sure. I'm Peggy Semler. I am the director at Frameshift Group, which is a consulting firm. We do system improvement, quality improvement. My personal background is as a pediatrician who has not actually practiced in a long time. I've worked also in public health, public policy, and most recently in these systems improvement types of initiatives. Amy?
Yes, good afternoon and good morning. Yes, my name is Amy Lewis. I am a therapeutic foster parent and have been on both sides. I've also been in the behavioral health system, but currently I am a therapeutic foster parent to 2 teenage girls.
Good morning, everyone, or good afternoon. My name is Laura Berger Lucas, and I just wanted to let everybody know that the 4 of us are representing just 4 of the partner groups involved in the initiative that we'll be talking about. I am the Senior Director of Family Support and Education at the Family Involvement Center. Just a little bit about the Family Involvement Center. We're a family-run organization. We operate statewide in Arizona. We offer peer support and actually a wide array of services to families and to individuals across the lifespan. Our behavioral health contracts are mostly fee-for-service, but we also have grant funding and a variety of contracts and MOUs with system partners like Juvenile Justice, the Department of Child Safety, and Education. We've been around for about 18 years. And just to give you a sense of our size, our parent peer support program alone serves about 200 to maybe 225 families a year. So thanks everybody for being here. Amy?
Yeah. So we're going to discuss what the problems are and what we're trying to do to solve them. Some of the problems from the perspective of the parent is one of the things that I see is the turnover. Staff turnover is it happens very often, and it makes it difficult for families to move forward in getting the services the child needs. And then also training, because as the turnover, people have to be retrained. Families find it difficult to kind of reshare their information over and over again. And then also lack of clear procedures in kind of obtaining the service. Different people have different ways, and different agencies have different procedures. So it is also as well difficult for the parents to kind of navigate the system when each agency has different procedures. So I think just being able to present to the families the procedures and how to go about getting the services they need. Kavita?
Yeah, thank you so much, Amy, for starting us off. First things first, has been the convener in this work for a number of years, and hearing from family members like Amy and others really drove us to invest in this work and work with partners such as Peggy and Laura and many others. You know, I think whenever we are looking at investing funding in a system change project, you know, the first question we have to ask ourselves always is, what problem are we trying to solve? And here in Arizona, you know, from feedback from not just providers, but most importantly families, is that our early intervention system as a whole, and I say early intervention, it's not just our Part C or Part B state agencies and providers, but our whole entire system that supports children with developmental needs just isn't working very seamlessly. It's overburdened. We have many families that don't necessarily know where to turn to. A lot of families are being told to go to our Part C providers when there's any type of concern on the development. But unfortunately, we are a very narrow eligibility state here in Arizona for our Part B and Part C. And so we have a system where so many families are being told to go to our Part B and Part C, but are not being found eligible, and hence then are kind of lost in the system. And when they get lost, our biggest fear is that these children with developmental concerns, their needs are going unmet. And so really that's the whole problem that we are trying to put effort towards in really clarifying roles amongst stakeholders so that families like Amy and others, their needs can be met really well. Next slide. Amy?
Okay, our goal is to be able, like Kavita was saying, is to provide the services for the children and guide the families and the parents in the direction that they need to go, and just be able to give them kind of a voice for their children, for themselves. And I think it's important that they receive the services in a timely manner, because when they're, you know, reaching out and trying to get support for themselves, for their children, at times it's difficult to get it in a timely manner. So I think that for me, that's the most important. And then also is to ensure that they're getting the services that they need to make progress, to have their children, you know, supported. Kavita?
Oh, thank you, Amy. I couldn't have really said it better. And that's what I always find hearing from families like Amy. Amy, you said it so well. I think being a parent myself, when you need help, you need it now. You don't need it 3 months from now or 6 months from now. You need it in that moment. And you need the right services. There's nothing more frustrating than needing help and either not getting the help or not getting the right help. And so we're moving towards having a cohesive, coordinated system of support and services for families that are experiencing their children having developmental concerns. And so we are inching our way closer towards that goal.
So one of the things, this is Peggy speaking, one of the things with these kinds of initiatives is really thinking about the enormous number, frankly, of stakeholders who have a strong interest in improving our early childhood systems. As I think Amy and Kavita both said, it's confusing. It's not necessarily working very seamlessly. It's overburdened and all of those pieces. So there's a lot of people who really want to make things better. But one of the questions is, how do you structure something like this in order to do that effectively? And we are, of course, learning, and we would love to hear from you all if you're working in these same sorts of spaces, towards this. We're trying not to talk too much, so there's more time for conversation at the end. But if you have other ways of doing it, but our structure is that, as Kavita said, first things first, as our early childhood agency, has really been the convener of a number of groups to work on this. It's something that they're extremely good at. They have reach across the state. They have in all regions of the state. And Arizona is a pretty big state, so that's a big statement to have. But we also know that the early childhood system is not something that first things first in and on its own can improve. So there's a couple of different or several different groups that we work with. The largest group, actually, looks linear, but it's everybody's working a little bit together and woven together. But our state partners really subsume the state agency team members, which I'll mention in a little bit, as well as a number of individuals representing organizations, family-run organizations, child, like Head Starts, early education settings, school systems, healthcare settings, and people who are actually boots on the ground delivering services, as well as some philanthropic groups. So it's a really broad reach of individuals. The state agency team, we have very, very sexy names for these groups. I have to say, the state agency team is, as it says, there are representatives from the various Arizona state agencies that have a stake in the ground in delivering services in that early childhood arena, including Medicaid, our early intervention program, in the Part B, Individuals with Disabilities in Education Act, Part B, Early Education Services, the Department of Child Safety, our Department of Health, and we have tribal representation as well, because of course in Arizona we have a number of tribes. I think it's, I won't quote a number. It's a large number of individuals, all of whom are working, who live in their own nations, and so there are the governance in those places is both some state services in support of, but primarily tribally driven services and directed. And so we have that level of folks who really have the opportunity to look across how policies, both coming from the federal government and delivered at the state level, but also state level policies, can either encourage or inhibit the seamless delivery of services. So our state agencies, of course, are not in sole control of their own destinies, both because they have to live by federal rules, but also they have to live within the budgets given to them by our state legislature. But it's how do you do the most you can with the things that you're given, and how do we make that work effectively in service of these children and their families. On the other side, the implementation work groups, while we do have some of those agency level people who come to participate, those are really directed at people who are working boots on the ground, because that's what one learns at an, excuse me, at an implementation level is a little bit different. You know, sometimes the policies don't work the way that they are intended to. So early on, the stakeholder group got together and kind of identified some key areas, levers that they felt were important to address. One of them is how to coordinate developmental and sensory screening early on, so that the breadth of activities that were going on, trying to find children who may have developmental concerns or may be at risk for developmental challenges, to find them. And there's a lot of efforts, as I'm sure you all know, nationally around bumping up the rates of screening and how to make that go on. But what we also know is that screening is mandated in a lot of different programs. So any individual child, depending on the number of programs that they're connected with or not, may be screened a number of times, and there's not necessarily handoffs of what happens as a result of that. So that work group is really thinking about right now, because we have to focus in on little things in order to make big things happen. They're working on two things. One of them is, how can we improve that handoff connection of screening results between different types of organizations that are working with an individual child and their family? So that's one thing. And then the other thing that is interesting that they're working on is to think about, you can't get screened if you are not, well, you can get screened, but screening results in a risk identification, but there are a lot of things that can feed into developmental risk. So the other thing they're working on is how to more effectively connect particularly those kind of middle-aged young children, the 3 to 6-year-olds, into well child visits, because that's where that longitudinal record of health ideally is kept, health and development, and other kinds of conditions or environment affecting or early development can also be addressed. In addition, in Arizona, we're really good at referring to the education system, less good at connecting the loop back to healthcare. The second group is looking at how can we better support families in navigating the system that we have. In our ideal world, of course, we would have an easy system to navigate, but we don't. So it's looking at the ways right now that families are actually having to go through the process so that we can then learn and map that out and learn where and how we can hopefully smooth those bottlenecks, improve those handoffs, and also just learn how to create a more coherent environment for individuals and organizations that are helping families to kind of move through the process. The next group is looking at those services and interventions that are out there, really looking at the availability and breadth of the supports to which to refer families and children. And of course, that's one of the areas that's kind of tricky because, of course, all systems are local, right? So for a family and for any individual provider that's sitting across the room from that family, hopefully at 6 feet distance these days, at least, with a mask on, it's all local. So depending on where you live, whether it's urban or rural, frankly, you have better or worse access to the services and interventions that that child and family needs. And one of the things that, as we're digging deeper into this work, that is becoming evident across all of these individual focus areas is that the surface understanding and the surface language is much more comfortable to understand than when you start digging deep. Because when you think about services for a child with a developmental concern, and you say, so what's the next step in the process? Our groups are understanding that there are a lot of potential next steps depending on the specific types of developmental concerns that are there. So that is a tricky process to think about, identifying these systems of care, thinking about what's important at a state level, what's important at a regional level, what's important at that local level, and at that microsystem level, meaning that one clinical setting, that one family resource center, what do those individuals need to know around the services and interventions that are available to them? And finally, professional development as an underpinning is really another group that is incredibly important, because none of these other types of work would be effective without a strong, well-trained community who are available, who are prepared to deliver quality service. So we're working towards that. You know, we'll never get perfect, but we can continue to strive to get better. So that is really the structure of our initiative right now. But I would be remiss in saying, and I think we're going to turn to right now, the critical importance of having the lived experience of the folks that we're trying to help. So really it's how do we strengthen family voice and presence and active participation, and actually ultimately, hopefully, you know, sort of that user-centered design idea in working through this initiative. So Laura, I think you're going to talk next about recruiting families so far, how that's worked.
Yes, thanks, Peggy. And I really want to underscore this idea that this is what we have tried so far. A lot of the efforts that we have made we've experienced varying degrees of success, and so we still are trying to learn some of the better ways to get families connected to these kinds of systems reform. There's plenty of opportunity here, of course, to weigh in and to provide information, and a part of our work is to create pathways that allow families to do that effectively. So as far as this initiative goes, the Family Involvement Center was charged with populating both the work groups and the stakeholders committee that are contributing to this effort. And some of the groups that we targeted was our Family Involvement Center has a family leadership forum. We actually have a couple, and Family Leadership Forum is comprised of advocates who have been through leadership training and have systems change experience. In Arizona, we like to change things up a lot, and so we have a lot of experienced families who have seen this type of systemic change over time, and it's a really valuable constituency to bring into this kind of effort because they have the ability to see everything from the beginning to the end. We also targeted our grandparents group. We have a very robust group of parents who grandparents who are parenting or caretaking their grandchildren, who are interested in using their experience in providing insight and information about how to make services more accessible. We reached out, of course, to the families that we serve who have children within this age group. We immediately targeted that population, but we found that many families with young kids are busy doing other things. And so while they may not have time to come to groups or participate in those efforts in a more active way, some of them were able to provide examples, written examples, case studies of their own experiences about the way that the system works well and the ways that the system is not working as well as we all hope. There are consumer advocates or fixed staff. Many of our Family Involvement Center staff are parents and grandparents, and so some of our staff are participating in this effort. We have consumer advocates across Arizona who have worked tirelessly to try and help support system change. And then provider agency partners who, again, have relevant experience with this, either parenting this age group or with children who have kind of worked through that stage of 0 to 5 and are now experiencing either success because of the services they were connected with, or challenges as related to the lack of services. our methodology for connecting with families is has been, we have a pretty robust social media presence, and so we have tried to advertise this initiative and try and draw in families who may not be connected to the Family Involvement Center, but who follow us on social media or have connection with our system partners. There are a couple different family-run organizations, so we're blessed to have a lot of folks who are familiar with this work, and we've reached out to them as well. We created flyers and posted them in our offices, as well as sent them out to our constituencies. We've sent out mailings to our system partners and other providers in our community. We received referrals. We were very fortunate to have, again, a statewide interest in this reformation. So many of our system partners who know families or who have parented kids with challenges or developmental needs themselves have reached out to us and wanted to be on these groups. And we provided stipends and other incentives. And then we found that somehow this became a part of the culture of families that exists within any system, who sort of talk to each other about what's working and what isn't. And so word kind of got around that this is what these were the efforts that we were trying to make. And some families came to us in that way as well. I'll talk about this in a couple minutes, but one thing that I want to say here, again, these methods have had varying degrees of success. We do know that commitment to participating in these groups, there's a lot of activity. This is a big initiative. And so even participating in a part of these groups is a pretty big commitment for families who are already kind of dealing with their own parenting, their children's needs and their own family needs. And so I would love to hear from anybody, we would love to hear from anybody about other strategies we might employ to attract families to us.
Okay, the next slide.
Amy?
Yeah, so the next slide. While working through this initiative, we've looked at what's working well. You know, one of the things I think is very important is the strong family presence. You know, just having that voice of the family, and because ultimately it's their family and the direction that the services need to go will be kind of guided by them. Also, having the families co-facilitate is important. I mean, I feel that leading a meeting, or, you know, that's for their family, or just a meeting in general with other families, that I think is great. You know, I appreciate when I have a staff member come to me and, you know, ask me questions on what do you want to see in the agenda? What do you want to see happen in this meeting? The virtual meetings, I think that's assisted greatly with, you know, missed appointments, because people, it's already, I think it helps to ease the stressors, which is at times transportation and then also childcare. The family, you know, the involvement center, just connecting and engaging with the parents and the families, I think is great, and helps the families feel, you know, engaged. And then also facilitators ensure that the families have space to share. So that kind of goes back to, like I said, having the families lead and facilitate the groups. I mean, when it's family driven, and I feel like the outcomes are better when the family's invested in the services, or when they create their own goals. And then also is ongoing acknowledgement from the work groups and other stakeholders. I mean, I think using the family's experiences and culture as a strength, it just ensures that the services are individualized. Peggy?
Amy, I think that you covered that really well. So I wonder if we should just turn to the next. Yeah.
Okay.
Yeah.
So what's working, less well? I mean, I think one of the things that I've also struggled with and just found it a little bit difficult was the on-site meetings for parents. I mean, like I stated before, transportation and daycare is always a struggle that I, at times for myself, and then I also hear other families. When I worked in the system, that was one of the number one things that parents struggled with. Also, on-the-fly data collection, like we've all said, families are extremely busy, so when something is just put on them or brought to them, it makes it difficult, I think just to gather the proper and the correct data that's needed. Family, the use of jargon, I also found that difficult in the very beginning when I started looking for services for my child. I didn't understand, and I think at times families, they feel left out when they are hearing or seeing things that are unknown or unfamiliar to them. So I think that's another thing that I've had to learn, that I've had to practice to not use the jargon as often. And then finding a balance between the frameworks and then also the real life solutions. I think real life solutions are a strength when you're working and providing services, because I feel that when you include the families, they feel invested because it's personalized to their family. So I think using their real life and their strengths is essential.
Yeah. And I'll tag on to say, as the facilitators of this process, I think that it's really just answering both of those questions, is what's not working as well and what's working. Is we have to just continue to be really sensitive to what's not working well, so that we can kind of shift things towards how do we make it work. So as Amy said, the virtual meetings, I think, have been helpful, and we're really actually pleased to say that we were very prepared for social distancing, because we had shifted for the work groups to a virtual meeting environment at the beginning of the year, after having a little bit more predominance of in-person, with the ability to link in through a web connection, which I'm sure you all know is really not the optimal way of moving a meeting if you're on the web connection and everybody else is in the room. It's just a different sort of interaction. It's helpful, but not perfect. So these virtual meetings, and I'm happy to hear that it helps with the sort of the family issues as well, because those are very real, and also travel time for everybody. I think that that's a universal truth. And the other piece, I think, in terms of trying to be vigilant about, is something that again Amy talked about, and what's working is that space to share. And we're just really pleased that we've had that strong partnership with Family Involvement Center from the get-go. And, when things, we get called on, when things aren't working so well, so that we can work to fix them. So it really is important to have those strong partnerships at the beginning, and building all of the work, again, around and I, as a systems person, I think of the customers of the process, and those customers include the families. They also include those boots on the ground providers as well. How do we really find that balance of the best solution that works for both of those groups? So, Amy, I think you are, yep.
Yes. What families are saying. So, I mean, I think what I see, and when I talk with other parents, just in groups or even in chats and stuff, that in the initial, when intake is being completed, they don't feel that a lot of information is shared. So I think it's very important that when they start the process from the intake, that information is shared, and then also the choices that the family has. So I think that's extremely important. You know, again, considering childcare or child watch, I mean, doing the web or the meetings online, I think is also, it's great, but then it has its side where, as a parent myself, I'm with children all day, so it would be nice just to kind of have that interaction with other parents, you know, face to face, and then also just to see that I'm not alone. There's other families that are having the same struggles, is, I think, is essential. And then, you know, offering transportation is extremely helpful. You know, bus vouchers, or even, you know, when you do, like I said, what I had stated before is being in person. When you make a connection, you can also make friendships, share rides, do stuff like that. Next slide.
We did want to, this is Laura, we did want to spend some time talking about what we have learned. And I'm hoping that everybody will participate in this discussion, but I'll start us off by saying, from the Family Involvement Center's perspective, I think we wish we would have done more to educate other stakeholders about what it means to have a family participating in these types of efforts. I think we talked about some providers make assumptions about what motivates families to do the things they do or to make the comments they make. Some providers, in my experience, might misperceive a family's experience, negative experience, them sharing it or talking to other families about it. Of course, our families are never trying to say that their provider, you know, was intentionally trying to not meet their needs. But when we share criticism, I wish that we had sort of done more education about the fact that we're offering information solely to try and create improvement. I think that we've talked about jargon a couple times, and it's a challenge to eliminate jargon from groups that are mostly populated by professional team members. And I have been, as a part of some of these groups, I have been have had various degrees of success in trying to kind of raise that issue continually. So I think those are some of the things that we wish that we had done more of in the beginning of this effort, and need to find ways to kind of bring that into to the remainder of this initiative. And hopefully others have some things to share as well.
Yeah, Laura, this is Peggy. I actually would like to kind of expand on that idea of the jargon, because we have found in this group, because there are people who work in different disciplines, that it's really important to have the group get really clear on what they mean when they use specific words. Something as simple as the term screening means something very different to folks who are screening for eligibility for a program, as opposed to screening for developmental concerns, or other reasons. And even if they're both screening for developmental concerns, they may be, when they say the words, they may have very different pictures in their heads of what those words mean. So just being annoying about clear communication has been important, I think, in making sure that everybody understands, and is talking about the same thing. And when I say annoying, I'm sure Kavita will reinforce that with a little, you can roll your eyes, it's okay.
Not today. No, I agree with everything that's been said. And I think one of the things that we tried really hard to do, mainly because of Peggy and Laura, is get families involved, like Amy and others, right from the get-go as soon as we could. And doing that any later, if you're looking at a system transformation project, really would be just as a disservice to both family members and to the professionals at the table, because it does take a little bit of time to acclimate. I think some of our professionals weren't used to family members being engaged in system level conversations, and it took a little bit of time and a lot of facilitation work through Peggy and her team to help us all find a new norm of how to have conversations with each other. I think one of the things that was done really well, and that's I think because we had Family Involvement Center involved from the beginning, is supporting family members outside of meetings, so that family members really felt that they had the support to walk into these system level conversations and figure out how their experiences as family members fit into these larger system conversations. And, sometimes walking into a group of professionals can be pretty intimidating. And I say that even as a professional. So when I think, and I put my family member hat on, it can be tough. And so I think having a peer-led, peer-run organization be really a part of the leadership of an initiative has allowed everyone to understand how the family voice can be incorporated and work hand in hand, how to support family members before they walk into meetings. We would never want to invite family members completely green into a meeting. I think we'd probably scare people off, like folks like Amy and others, if we didn't adequately prepare them and ask them what they need in order to feel comfortable to participate and to feel successful in their participation. It's really important to check in with family members before you invite them to system level transformation meetings.
I think we pretty much covered the content in the slide, except to say maybe we didn't cover this idea that families should be involved as soon as possible in this effort. Sometimes we forget that when early discussions happen, families don't have the context, and so moving in to an already established initiative where goals have already been outlined can be really difficult. And so I think that's one thing that that we would advise others to do, is make sure that families are on the ground through early discussions as well. The other thing that I think we're hoping for, honestly, is any advice that you all might want to share with us. Our assumption is that other states have gone through a process like this, and so if you'd like to share in comments some things that you have tried that have been successful for you, we would love to hear them.
And I think that given the format here, it's to chat it in. But as you're thinking about that, the one other thing I want to emphasize, and this is Peggy, is build family engagement into your budget. Your budget is basically your strategic plan, and if you have a strategy that involves families, put some money behind it, because there is a cost to be able to support the whole infrastructure to really create that effective environment.
Yeah, so this is Kate Wasserman, co-hosting this with Lauren Rabinowitz. People are now open to either typing in the chat or unmuting yourself and asking a question to any of the presenters today on the extensive integrated work that they presented on.
And you can feel free to use the chat if that is easy.
So while people are thinking, so Crystal has been typing in about using virtual delivery, and I think that is such an interesting topic right now. They're using it both for, it looks like teens, Crystal, I don't know if you want to kind of talk about it yourself, but for teens in terms of just keeping in touch with their sort of mental health checks, but also for delivery of therapeutic services. And I think this is going to be one of the big questions that we all need to be really thoughtful about addressing. It is a huge opportunity for virtual delivery, and it really does change, I think, sometimes for the better, that kind of connection to services. But I think we also have to, I am so excited about it, but I think we also have to kind of continue to examine, does this honeymoon period, does it stay over time? Are we going to see, sort of similar or different effects? So that is yet another layer that's being put into our improving our systems here, because it's availability and access to services, which certainly in Arizona is a challenge. I'm sure it is for everybody everywhere. And Crystal, who is, I think, from, are you unmuted now?
West Virginia, I think
Yeah.
she's from, yeah. It's such an interesting point, especially when you think about parent voice and family engagement in meetings, right? Because, one of the biggest barriers that we hear about is, scheduling and access and the need for childcare if they have other kids at home to come to the meetings. And so, does this sort of process that we've all been forced to embrace, right? And perhaps we're a little bit resistant to before, does it offer more equity, frankly, in terms of accessing meetings? But then, Kavita, to your point, how do we really prep families to feel authentically involved if that's the way that they're joining when everyone else is in the room? And, so yes, what is sort of facilitation of family voice and family-led meetings look like in the sort of a telespace?
Yeah, it's definitely when everyone is participating via like Zoom or WebEx or whatever the platform is, there's a little bit of evening out of the playing field so that everyone can participate in the same way. When I participate in anything virtually and everyone else is in the room, there's a little bit of a downside there, being able to read the room. You don't know when to join in a conversation. I think with COVID-19 and moving all of our meetings to completely virtual platforms, I don't know, I'd have to actually look at our attendance, but I feel like we've even had stronger family engagement and participation for all the points that Amy has already pointed out. None of us have to travel anywhere, but that becomes even harder for families. And then childcare. And I will say, and this happens to me, and I'm always so grateful to Peggy for always smiling through it, but whenever my kids appear in video and I'm in the middle of a meeting, there is such a welcome and such an embrace, and that is given to everyone that's participating on a call, because that's just life. And it's kind of our new normal right now, whether we are professionals or family members. At the end of the day, if we're parents, that is that thread that binds all of us. And so it's been a really interesting shift, and it's one that I have actually really loved. And I love seeing people's kids.
Yeah, it's interesting because, Amy, you brought that up about, even when you're at home, it's seeing other adults, and it's also like having to juggle family. And the beauty of this now is it's shifted the power dynamic, because everybody is working under the same conditions. If you have kids or for me, unfortunately right now, fortunately my kids are grown, but the dogs are the ones that interrupt, but you're handling interruptions, you're kind of managing all that. And you're also an equally sized square on the Zoom box. So it really does different things for those power dynamics in a way I think is really very important for this work.
One of the things that I would add is and I think this speaks to the investment of this, of all the constituents involved in this transformation effort, is, Peggy, correct me if I'm wrong, but I don't think that we've seen too much of a drop off since everybody has been sort of preoccupied with all of the COVID situation. And so folks are still showing up. And that could be because we're making opportunities available virtually, which, as Peggy mentioned, that has been the case since the first of the year. And I don't honestly know why it is, but I think that it's pretty impressive. This is a wide-scale reform. It's a big job to do what we are trying to do. And the commitment has stayed steady even throughout a lot of changes in the world. So.
Mm-hmm.
No, I'd agree with you that we've actually had, in some cases, more participation, as both you, Laura, and Kavita mentioned, in terms of just kind of ability to participate over time. What we've noticed is that for all of our members, there's some ebbs and flows that happen that tend to be more related to, I hope at this point, of course, external circumstances within individuals' lives. And that's true, again, not just for our family representatives, but for some of our other representatives as well, that just life happens. And I think that that is one of the challenges for systems change work, is that you have to plan for change. You have to plan for change in who's participating, and you have to plan for onboarding in the midst of a conversation, because life happens. Yeah.
Well, this is obviously the contact information for all of the folks who have been here today. So again, we welcome any feedback or suggestions or any type of response to the information that we presented. And we hope you'll all wish us luck as we continue to navigate this change.
Well, on behalf of the TA network, just really want to thank you all for taking time to share, and really more than anything, thank you for sharing these different perspectives of the work. I think that's not something we always have the opportunity. Sometimes we hear, from one side, or maybe it's the program developer or something, but just to really give us the full spectrum of the experience has been really, really useful. So we thank you so much for your presentation today. Thank you so much for those that took time out of their day to attend. This will be recorded and available on our website. We can make sure to get you all connected to our early childhood learning community online learning management platform. And we just wish everyone a good day, and thanks so much for joining.
Be well. Thanks, guys.
Thank you.
Oh, I'm sorry. And we have a survey there. It's link is in the chat, and when this closes out, you'll be taken directly to the survey.